has become one of the trendiest words and one of the most popular topics in the moment. In nowadays society, people are less interested about going through life and more so about living the life. Although the typical pattern of growing, breeding, dying is inevitable, in our modern world we surely like to defy time, age, illness, and even our own mortality. With the consistent exponentially increasing changes and developments in technology, we have managed to modify our lifestyles and social constructs in such a manner that we regard illness as an obstacle that we are willing to handle and manage in the best possible manner for as long as possible. We no longer want to compromise on the pleasure of our worlds, whether that is eating, traveling, smoking, drinking, or working excessively. Instead, we are willing to abuse our body and manage the outcome. While infectious disease focus on the cause, chronic disease address healthcare from a different angle, focusing more on the effect, even though two of them cannot be segregated, and in some cases both of them exist at the same time, as in the case of HIV responsible for AIDS, hepatitis B and C responsible for liver cancer, or HPV, the human papillomavirus, responsible for cervical cancer. The chronic disease experience is very different from the infectious disease one, and so is the care and management of the chronic diseases. Many chronic diseases are associated mainly with behavioral risk, and while the diseases are not themselves communicable, the behaviors are, however, not through direct physical contact, but rather through ideas that are transmitted instantaneously at a global level through satellite broadcasts and the internet. With new pressing social and healthcare issues, the main focus is no longer directed towards the biomedical approach of medicine, but more so towards the biopsychological approach, a model that places patient at the center of the illness experience. The initial biomedical model, which placed the doctor at the center of the stage, was very limited and concentrated on trial, diagnosis, and treatment, a process in which the doctor was in control and the patient had a more submissive role, being held responsible for any bad outcomes or failed results. Humanizing care is especially important because of the changes of the illness experience. With chronic disease managements, patients need to maintain a close relationship with their healthcare provider, sometimes a lifelong, which changes the game plan. The doctor is no longer the person you once saw and then never again, but instead becomes a part of one's life and daily routine. Having a close and positive relationship with your doctor is imperative for having good outcomes with the positive long-term changes. Through narratives and consistent alternating feedback between healthcare providers and patients, the field of medicine is becoming more dynamic, complex, and interesting, enabling all parties involved to take a quick and informed and shared discussion through a meaningful exchange of information that has a positive impact on the outcomes of the treatment. Take for instance diabetes, one of the most prevalent chronic diseases of our modern-day world. According to the CDC, diabetes is the leading cause of kidney failure, lower limb amputations other than those caused by injury, and new cases of blindness among adults. People with diabetes either don't make enough insulin, typically known as type 1 diabetes, or can't use insulin properly, known as type 2 diabetes. Insulin allows blood sugar, also known as glucose, to enter cells where it can be used for energy. When the body doesn't have enough insulin or can't use it effectively, blood sugar builds up in them. High blood sugar levels can lead to heart disease, stroke, blindness, kidney failure, and amputation of toes, feet, or legs. Type 2 diabetes accounts for 90 to 95% of all diagnosed cases of diabetes, and only 5% for type 1 diabetes. Type 2 diabetes, which is more behavioral illness than anything else, is dependent on the lifestyle and the choices of the people suffering. Some of the most predisposed populations are the African Americans, the Native Americans, and the Latinos, due to certain aspects of their cultural habits, traditional food preferences, and socioeconomic status. However, diabetes is also known to be a disease that affects all generations, cultures, races, and gender groups alike. Hence, mentioning just a few of them will be erroneous and misleading. Factors that can lead to type 2 diabetes are varied, with some of the most common being low income, extended urbanization, monetarization, demanding jobs, high levels of stress, lack of opportunity for physical activities, expensive healthy food, and excessive exposure to media, among others. With this in mind, managing a chronic disease such as type 2 diabetes can become challenging just by taking into account the variety of populations and the amount of people that need help. A diabetes 2 management health campaign would have to encompass a wide variety of service and information access that are enticing to all groups alike. Some of these resources that are relatively inexpensive and at the fingertips of anyone interested in finding help are the online health communities. An increasing number of people visit online health communities to share experiences and seek health information. 72% of Americans search for health information online, according to a 2013 Pew study. In 2013, about 77% of online health information seekers stated they used websites such as Google, Bing, or Yahoo. 13% visited specialized websites such as WebMD. 2% visited a more general website such as Wikipedia. And 1% began their online health information seeking with social network through websites such as Facebook. For example, WebMD.com is an online health community platform that contains multiple illness forms and is sponsored by large medical or commercial sponsors. It features over 35 online health communities and is one of the few communities that offers both health professionals and staff moderators. Health professional moderators at WebMD have clinical training in medicine, nursing, or nutrition. Staff moderators do not necessarily have that clinical training, but participate as staff moderators in conversations. Each community has 1 to 3 assigned health professional moderators, while staff moderators often participate across multiple communities. From the federal to state governments, from most prestigious to universities to the local church communities, there are plenty of resources and reliable web pages that patients with chronic diseases can access. Mobile health, or also known as eHealth, is an emerging concept in healthcare and uses mobile communication devices for health services and for information. According to the Centers of Disease Control and Prevention, mobile health is a subset of eHealth, defined as the use of mobile computing and communication technologies in healthcare and public health. The most common application of eHealth is the use of mobile phones, but can also be used in other communication devices, such as tablets, data writers, and personal digital assistants, to educate consumers about the preventative health and relate healthcare services. eHealth is also used for disease surveillance, treatment support, epidemic outbreak tracking, and chronic disease management. With eHealth systems, glucose data can now be automatically collected, transmitted, aggregated with other physiological data, analyzed, stored, and presented as actionable information. eHealth systems use mobile decision software support applications to assist or direct healthcare professionals to make decisions, or they can assist or direct patients to make decisions without waiting for input from the clinician. With real-time decision support for patients, appropriate action can be taken in real time without waiting to see a clinician. Decisions can be personalized if individual treatment goals and personal preference for the treatment are inputted into the app. The rising availability of these mobile technology corresponds with an increase in ownership of mobile telephones and tablets, and the use of apps. National surveys in 2013 found that 34% of U.S. adults owned a tablet and 91% owned cellular phones. Of cellular telephone owners, 55% had a smartphone and 50% downloaded apps onto those phones. This is an increase of 22% from 2009. The most common type of diabetes apps identified were for health tracking or self-monitoring tasks, such as recording blood glucose levels, insulin levels, and medication use. Other types of apps were insulin dose calculators, physician-directed apps, food reference databases, social forums or blogs, and exercise apps. Nevertheless, even with the development of new and performance technologies, one issue that remains is the lack of knowledge and the low level of literacy, especially health literacy, among many people, due to disparities at social and economic levels, as well as terms for health literacy. Accessing quality healthcare information regarding cancer, heart disease, or diabetes can be a challenge for a large percent of the general public. Very often, health information is available, but not easily discerned from other inaccurate pseudoscience material that circulates around on the web. This erroneous information often confuses, misleads, and frustrates web searchers. Since it becomes tiring, it can actually have a negative effect on the public, and dangerous consequences for people who lack critical thinking and or the level of education to start research to understand what they are suffering from. This erroneous information often confuses, misleads, and frustrates web searchers, since it becomes tiring and it can have negative impact on the public. Dangerous consequences for people who lack critical thinking and or the level of education to start research to understand what they actually have. Internet and technology accessibility still remains a problem, which adds to inequality among social classes, ethnic groups, and cultures. Coupling this with the fact that many insurance companies, hospital, clinics, physicians, and support staffs are moving towards a digital-based healthcare service, many problems result, including healthcare disparities that may not have existed a few decades ago when analog database storage was used. Telemedicine has provided a great deal of assistance in multiple facets of the medical world, but is also showing some amazing promise within the field of psychology. Psychological telemedicine is an area that has seen a great deal of expansion due to overwhelming demand. The treatments and therapies used can be applied for either lifelong chronic treatments and mental afflictions. Likewise, both require the assistance of a trained psychologist. A problem-solving model of chronic disease self-management is proposed, derived from theories of problem-solving in cognitive psychology, educational alternating theory, and social problem-solving. Four essential components of problem-solving in disease self-management are identified. These are problem-solving orientation, disease-specific knowledge, and transfer of past experience. In the case of diabetes, this is shown with a trial held by the Diabetes Prevention Program, which determined that if a participant had a 7% loss of body fat, it reduced the incidence of diabetes by 58%, along with the use of oral medications. This proves how important self-efficiency in the management of chronic disease like diabetes, and how daily rigorous diet implication makes a patient's life much easier. With telemedical psychology, that is all a part of the past, because anytime the patient is unsure or feels like wavering from the path of health, they are able to get in contact with someone who can assist them. The psychologist will be able to provide them with information and tips to make the transition easier on them, while at the same time providing relief mentally from having to deal with the illness like this. The change of lifestyle and adherence to the change is the most vital thing to allow the patient a longer and happier life. Psychologists are able to make sure to keep them feeling happy so they can continue down the path of health. While diabetes is a huge concern, it is not the only chronic illness which is slowly affecting the well-being of our society. Illnesses such as coronary heart disease also bring about a certain level of fear and depression. Many times people feel depressed or hopeless following a huge attack from their illness, and this is normal for a patient to feel, but it does cause a great deal of problems. This depressive state is not one that promotes healthy habits, nor does it make the patient feel as though they have a reason to continue with any other treatments. The consistency of the treatment and health is then compromised, which is the greatest concern when a patient is recovering or dealing with a chronic illness. Psychologists have then found a way to slowly assist the patient in bringing about a lifestyle change, which is not too sudden and allows an easy follow-through, usually by showing the patient how to move about their daily life following such an illness, and providing assistance in any situation where they feel overwhelmed. Counseling and stress management is one of the options available to a patient. This, with combination of submaximal excursive, is shown to bring a 25% reduction in cardiovascular mortality rates. These advancements in medical treatment applied within eHealth and telemedicine stand for the progress of our society, and has achieved a great many things in the medical field, among others. However, our healthcare system still needs to be improved in many aspects that does not represent or serve the greater population as it should. To have access to eHealth and telemedicine, we need to expand availability to services underserved and geographically isolated populations who need them the most. Much needs to be done, but if we can start by providing more funding, technological assistance, health coverage, and education to these populations, we will be taking a step in the right direction. Increasing the quality, accessibility, efficiency, capacity, and strength of our healthcare system has to be by far one priority we have to focus on.